Well, I think it's a very well thought of and a very meticulously done study going back to, the heavy metals, different kinds of metals, and differentiating metals which, are harmful, and the metals which are usually present in, vessels which are not severely involved in atherosclerotic process and pathological states. So, Ajit, what is your take on this, and how do you consider this adds to our, information and knowledge in the management, as well as, choosing the kind of stents for the future?
I think this is a very unique presentation. I think that we are looking at non-essential metals as toxic for the worsening of maybe atherosclerosis. And I think that what we've seen in the past is that these have been looked at in the myocardium in many of the conditions like EMF and myocardial fibrosis, where we saw these non-essential metals going up. But this is, I think, very interesting to show that these were higher in autopsy specimens of patients with more atherosclerosis than less atherosclerosis. Now, I think it's a small autopsy study which we need to validate. I would also have liked maybe in vivo studies on patients, maybe bypass patients and atherectomy specimens, or maybe, something like directional paragangliopathy of lesions. They can be studied in a similar manner for both, these trace elements, and maybe we could have data on this more specifically and how we could treat them. The other interesting thing is the type of stents that we use are all, most of the metals which are found which are higher in this class. So whether the question is of bioabsorbent scaffolds coming back, maybe whether they are helpful or not, I'm not very sure about that, but I think this is an interesting study which needs further evaluation.
Right. So, Nitish, have you got some experience of your own on metals, heavy metals, and different metals in the pathogenesis of atherosclerosis, and how do you rate this study, and what do you think are the gains in our information regarding atherosclerosis and future management?
Yes, I think so. That's an important point that the study has raised and takes you back to those old days when you had chelation therapy coming up, and then there were positive results shown way back in 2002 when chelation therapy seemed to have reduced the incidence of future cardiovascular events. So I think so. This is a very important point that has been brought up by the study, something that had been our blind spot for all these years. But at the same time, I would have liked the investigators to have also looked at some other areas where you could have found these heavy metals. For example, in other tissues like hair, in nails, because it is intriguing to see why there was this preponderance for heavy metals to deposit in coronary atherosclerotic plaques and not elsewhere. And was it that this is related to what is the source for these heavy metals? Is it environmental exposure? Is it through our food chain, or is it through any other means? So it also brings into relevance and focus the importance of air pollution in cardiovascular diseases. So I think so. This study has raised very pertinent questions, and I feel that there is much more to be done. And as Dr. Ajit said, it also gives us an opportunity that when our surgeons go in and do endarterectomy in patients with prolific coronary artery disease, we should also be examining these specimens for heavy metals. So yes, I did find this study very interesting.
Yeah, I think I also feel that the study is very interesting, well thought about, but it has left many unanswered questions. And as you rightly said, that from where are they coming? Are they coming from the pollution? Are they coming from, some kinds of, foods we take? And is it dependent from place to place? Is it different? As Ajit said, that, we are looking for such things in good old days for endomyocardial fibrosis, whether tapioca is producing it, whether plantains or bananas are doing it, and that was all related to some of the things which were, in these substances, not actually the food value, but the other, whether you call them pollutants or whether you call them, components of these things. So I think it has, some lot of importance, and it should lead to many newer studies in this particular direction, so that we can get some more information which can be useful in the management and prevention. I would say rather prevention of significant atherosclerotic disease. Thank you very much. So we now go to an interesting study